From CBS 4, this is Haystack TV, powered by HaystackHealth.com. Finding reliable services can be like finding a needle in a haystack. With HaystackHealth.com, finding the needle just got a lot easier. Now here's the host of Haystack TV, Chris Kane.
Our nose may often be forgotten, but it's an important part of our body, bringing balance to our facial features. And of course, also helping us breathe. The doctors at Faces First are the leading experts in rhinoplasty, no matter the reason. They can help improve your self-image and much more. Dr. Christopher Cote is board certified in otolaryngology, head and neck surgery. He is also board certified in facial, plastic, and reconstructive surgery. Dr. Cote served 12 years in the Army, some of that time as chief of otolaryngology at Walter Reed Medical Center, where he performed facial reconstructive surgery on wounded soldiers returning from Iraq and Afghanistan. Dr. Christopher Cote from Faces First joins us today. Thanks for being here.
Thank you.
Now, I read that rhinoplasty was the most popular surgery for men in 2010, and then the second most popular for women. Why is that? And explain what rhinoplasty is.
Right. Rhinoplasty basically refers to the reshaping of the nose, and we usually do that surgically. And the American Society of Plastic Surgery says that it's one of the most popular surgeries. And if you look at the patients who come into my office for surgery, you'll find out why. We have a lot of people who, because the nose is the central part of the face, want some balance brought to their face, and they may have some features that distract other things. A lot of people also have breathing problems through their nose, and nasal blockage and sinus problems, and or they've broken their nose, and those are some very popular reasons why they may decide to have this type of surgery.
So it's not all cosmetic. So a lot of it, like you're saying, then it's because they're having breathing problems, but a lot of it can be cosmetic too. But regardless what the reason is, it's really important to see someone that's an expert like yourself that specializes in head and neck surgery.
Right. I think my background is pretty conducive to this type of issue because the nose is not just a fixture on your face, it's an organ in your body important for breathing. So we really understand how we can help somebody breathe better, but also bring balance to the face with a cosmetic procedure.
Absolutely. Now, what's involved in a typical procedure?
So a procedure, it's done in an outpatient environment. It's usually a 2 or 3 hour operation, and people go home, recover. There'll be some bruising and swelling for a week or two, but usually people are resuming their usual activities in that second week after surgery.
The average person that has had bad work done, there is hope because you actually can get involved and fix the problems that they've encountered.
Right. So there's a certain number of my patients that I see that are referred to me that need a revision of their surgery. They've had rhinoplasty done in the past. And what I find is that they want what everyone wants, and they want to achieve a natural look. They don't want to look like those celebrities in the aisle of the supermarket where it's overdone and obvious. People want a natural look. They don't want to look overdone. And so we can help those people.
All right, well, actually, let's take a look at some before and after pictures and tell us what we're seeing.
So this is an example of a pretty typical patient of mine. This patient was referred to me by a plastic surgeon, but she had severe breathing problems as well, some really narrow nasal passages. And at the same time, you can see she's a pretty attractive young person, but wanted to get that nose more balanced to the rest of her face.
Well, and it's a dramatic difference. I mean, she looks fantastic.
Well, she's very happy because she's going to be able to breathe well through her nose, and the nose looks well balanced to her face.
And what are we seeing here?
So this is an example of somebody who's had previous nasal surgery. She's had a rhinoplasty in the past and really wasn't happy with how it turned out for her. And she wasn't breathing well. So you can see in the after, we've brought a little more balance to her face. She actually even looks a little younger from the lifting of that nose.
Really does. And not only then do you do nose, but you work on the whole face like we mentioned. So if people wanted to get more than one procedure at the same time, could they do that?
Absolutely. It's not unusual that sometimes patients consider some additional procedures they may want to do at the same time. The chin, for example, may be something that might be small, and somebody wants to address that during surgery to bring more balance to the face. And sometimes people might have their facelift done at the same time as well.
All right. So people need to keep in mind that not only is it for cosmetic purposes, which a lot of people want to get done because they want to look better, they want to look younger, it makes them feel better, but also there's a lot of medical reasons for doing it too, where if you can't breathe, I mean, you can't sleep. So a lot of people get it done for a lot of different reasons. And I'm sure, like, working with returning soldiers from Afghanistan and Iraq, this is not cosmetic. I mean, this is something that they need to get done, I'm sure, just to get through the day and to feel better.
Yeah, I'm fortunate that my background has given me a diversity of experiences that have allowed me to build a good foundation for delivering good care to my patients. And I think that with that diversity, we can help make people be happy, which is my ultimate goal.
Yeah, and change their life. So thank you so much for being here.
Thank you.
I'm going to tell our viewers how they can get a hold of you. At Faces First, they put your face first. Dr. Christopher Cote has the experience and training to handle rhinoplasty for any reason, medical or cosmetic. Contact Faces First now at 303-744-2300 or visit their website at facesfirst.com. Call Faces First right now. The number again is 303-744-2300. Thanks for watching. HaystackHealth.com is a free consumer referral service. You can find more reliable companies like Faces First by going to HaystackHealth.com.